Hi, I'm Amanda. I'm one of the technicians here at EncinaVet Hospital, and this is Lucy. We're here to demonstrate to you today how to administer subcu fluids. You and your pet will be sent home with a type of fluids, either lactated ringers, normal salt, or sodium chloride. You'll also be sent home with at least one type of administration set and one of two types of needles, either the larger 18 gauge needle or the smaller 20 gauge needle. Now to set up your fluids. We'll start with your bag of fluids, and each bag should have a notch in the side. You can tear it open to expose your bag, and the tip of your bag will have a tab on it. Simply remove this tab by pulling gently. The end will still be sealed, but please try and keep this as sterile as possible without letting it hit the ground. Next, to open your administration set, there's a perforated line. Just remove the perforated line and remove your set. Remove any of the tape that may be keeping it rolled together. Your spike will be covered in a plastic sheath. Just remove the sheath and again keep this nice and sterile, no letting it touch the ground or touching it with your fingers. And insert it into the port at a straight angle. Don't aim it up or sideways because you'll go right through the side of the bag. Gently twist it in, and now you're ready to go. You'll want to hang the bag. The higher the better, and we typically recommend either setting up in the kitchen or in the laundry room, so that way you either have a plant hook or you can hang it from a hanger from the ceiling or a cupboard handle. The higher the better because the gravity will be your friend on this. Next, you'll want to prime your IV line. So here is your chamber, and you can see the fluid line. You'll want to have your fluid line between the line and around the bottom of the chamber. To fill it, you'll just squeeze your chamber and you'll see it fill up just right to that line. If it gets too full, it'll be hard to see your drip rate, and if that happens, just simply turn your bag upside down, squeeze your fluids back into your bag, and then readjust to whatever level you would like it at. Now you want to prime your line and remove all the air from the line so you're not giving any subcu air. To do that, you'll have your clamp ready. And the down skinny position is off. To get your fluids running, you'll roll it up with your thumb and get it so that way there's a nice steady stream. Once there's a steady stream, you take your clamp and roll it back down to the skinny end. And again, keep this nice and sterile. You don't want to touch it with your fingers or lay it down on the table so that way it doesn't pick up any bacteria. To get your needle ready, all of your needles will have a nice plastic covering that will be sealed. To open it, you'll just twist it, remove it, expose your hub, and then place it on the lower tip of the administration set. After your setup is complete, you're ready to administer your subcu fluids. Remember, gravity's your friend, so try and hang your bag as high as possible. First, to demonstrate the amount of fluids that you may be giving, each hash mark is 50 mLs. This first hash mark is actually 100 mLs, and then each one after is 50. So if you're prescribed 200 mLs, your first dose will go down to the 2, and then each additional dose after that will go down to the 4, 6, and so on. Once you have your fluids set up complete in your bag hanging, get your pet on a nice comfy blanket on a surface that's easy to work on, and also getting them a tasty little treat will also make giving the dose of subcu fluids a little easier. Always having a food motivator helps giving not so fun things a little bit more tolerable to your pet. The way you want to position your pet will depend on if you're dominant right-handed or dominant left-handed. If you are left-handed, you'll want your pet facing to the right. If you are right-handed, you'll want your pet facing towards the left. That is so you have your needle in your more dominant hand. So to get your pet ready, you'll want to make a little tent for your subcu fluids. The best spot to make your tent is over the shoulder blades. You don't want to go too far forward close to the neck or too far back close to the tail because it's a much more sensitive area. And there's not as much skin to work with and a nice pocket to get your subcu fluids in. So to make this tent, you're going to use your whole hand and all your fingers to pick up a little chunk of skin and make what looks like a teepee. And the doorway to your teepee is going to be right here in the back door. And your needle is going to go right in through that little doorway of your teepee. So you'll pick up your skin, make your doorway, and when you go in with your needle, you're going to want to be nice and parallel to the body. You don't want to go sideways at an angle or up and down at an angle because you could go through the other side of the skin. So we'll remove the cap of our needle, make our little teepee, and get a nice little pocket and give the injection of the needle. You may feel a little bit of a pop, and they usually tolerate it very well, and your needle will go completely into the skin, so all you see is the hub, no metal left of the needle. Nice. In order to start the sub-Q fluids, you'll pick up your clamp again and roll it up so that way the wheel is all the way to the top of the white clamp. You'll want to check your drip rate at this point. Fast drips is better and even a steady stream is best. If it's too slow of a drip rate, you'll want to either hang your bag higher or check that your clamp is completely open. Once your dose is complete, you'll want to close your clamp before removing the needle. So again, you'll go down to your white clamp, roll the wheel down to the closed position, and remove your needle. You want to pull the needle straight out and just kind of hold a little injection site with your fingers to keep the fluids from backing out. In order to recap your needle when you're done with your dose, keep your cap on the table and use the needle to slide in there and then recap it with a snug little click. Once your dose is complete, always be sure to change your needle after each administration. This will help keep bacteria from building up and causing any infections in your pet. To remove the needle, simply twist and remove the needle from the lower tip and dispose of it into a Sharps biohazard container that we'll supply for you. Return this to us when it's full and we'll supply you with an additional one. To place the new needle on, you'll do the same procedure as previously. You'll have a new needle with the plastic covering, twist it to break the seal, and place the new needle onto the lower tip. Your bag will be ready to go for the next treatment, and if you have any questions or concerns or problems at all with your administration, feel free to give us a call here or stop by because we're here 24 hours for your pet's care. Thank you for joining us at Encina Online.